Starting with basics because people may not know. Where in the body is the bowel and what does it do? What's the function of the bowel?
The bowel is the colon and the rectum. And so we talk about colorectal cancer or bowel cancer. That's the same thing. It's just a terminology difference. And so when we talk about the bowel, we're really talking about the large intestine and the rectum. It's the lower part of our digestive system. So really, it's the part between the stomach and the anus, or where the bowel opens. And it's all of the food that we eat goes through the stomach. The nutrients get picked up, some of them in the small bowel and the small intestine, and then a lot of them get picked up in the large bowel and the colon. And so that's where, if you're going to have a problem with your intestines, it's probably going to be in the bowel, in the large intestine. That's where a lot of the issues have. So we're talking about the colon, the back passage, so the last part of the colon, which is the rectum, and to some degree the anus as well, which is the opening. But just to note that I guess we don't really consider anal cancer part of bowel cancer, and the screening test doesn't screen for anal cancer. That's something your doctor needs to check differently. But yeah, so the colon and the rectum, that's what we're talking about. And it's really just used in digestion.
Yeah. So as far as I remember from my Science 101, your large intestine is what carries water and salt, and your small intestine is what carries food. Is that correct?
Yeah, that's what they absorb generally. Yeah, so the small intestine is doing a lot of nutrient absorption, and the bowel is absorbing a lot of water.
Okay. Is food related? Because you mentioned anything from the stomach downwards.
Definitely, in terms of eating a healthy diet, so eating a broad range of food and healthy foods, and trying to avoid too much in the way of unhealthy fats and things like that. But fiber is a really big factor. So you really want a diet that is high in fiber, and that's good for multiple reasons. One of them being that it actually helps everything bulk up and keep moving.
Yes.
So it moves through your bowel quicker. I mean, your bowel's full of waste, right? You want to get rid of it. You don't want it sitting around in there. The longer it sits around, the longer you've got garbage waste sitting in there that your body doesn't want. So that's never a good thing. You want a diet that's varied, healthy, and really high in fiber.
Yeah. You mentioned it's number 2 in Australia, bowel cancer. What's number 1?
Number 1, I believe, is lung cancer. Yeah, bowel cancer is the second highest cancer killer, but one of the critical distinctions, which we might get into a little bit later, is the difference between picking it up early or picking it up late. That's a really fundamental difference, and something which is one of the reasons the bowel cancer screening program is so amazing.
And it impacts, I presume, every nationality. It's not like one nationality specific that.
No, it's not. It does impact people disproportionately in different countries. But one of the things we see is that it affect Australians more than a lot of other countries. But often if somebody comes to Australia from another country that has a lower risk, they kind of normalize to about the risk level of the country they've moved to. And we think that's to do with lifestyle factors, just the general factors associated with their daily, meal habits and lifestyle and things. So it's a little bit higher in Australia than a lot of other places.
Is it because it's something that we're not doing that the other countries are doing that it's higher in Australia?
Yeah, I think it's a bit to do with lifestyle, so diet and exercise factors and things like that as well. Diet is a big factor for bowel. And I mean, things like smoking, we have lower smoking rates than a lot of other countries, I think, but that's something that affects a lot of cancers. A lot of these risk factors are really kind of intertwined.
Okay.